I'm gonna walk into the room, I'll greet the parents, I'll let them know that my name is Ashley, I'm a student nurse with OCC, and I'm going to be doing a newborn assessment. I will wash my hands and put on gloves. Then I would compare the baby's wristband to the parent's wristband. So this baby is double wrapped, so I would tell the parents or explain that in order for the baby to go home, they need to be down to a t-shirt and one blanket. So it's important to not keep the baby bundled so they can go home sooner. I would check the apical pulse. So you're gonna listen for 1 minute, and a normal range is 110 to 160. Oops. While I'm there, I will listen to the respirations and just make sure the lung sounds are clear, or if there's any fluid. And then I'll watch the respirations for 1 minute. The normal rate for respirations is 30 to 60. A regular rate is normal with occasional pauses of like 5 to 10 seconds or 6 seconds. And then I would take the baby's temperature, and it's going to be axillary. You want to have it in their armpit and almost hold their arm down so it stays skin to skin for a more accurate temperature. While doing the assessment, to keep the baby warm, I would make sure we're away from a window. I would have the door closed. If there was a warmer in the room, I would put the baby in the warmer just to make sure that they don't get cold. I will assess the baby's posture, making sure that their extremities are flexed and moving freely and they resist extension. I would assess their skin, making sure they're pink, no jaundice, no signs of acronosis. Acronosis is normal for the first like 18 to 24 hours. So like the blue hands and feet is not too concerning. When I listen to the respirations, I also want to note any signs of respiratory distress, any grunting, nasal flaring, retractions, which is like the tissue in between the ribs almost gets sucked in with a breath. And no circumoral cyanosis, so like no blueness around the lips. And then I'm going to check their head. And you're going to check for the anterior fontanelle, which is kind of like a diamond shape towards the top of their head, and then you'll follow that suture back for the posterior fontanelle, which is more like a triangle shape. The fontanelles will be soft and flat, but they can be bulging if the baby is crying. You also want to note any cephalohematoma, which is like a pooling of blood between the periosteum and the skull. These can occur on one or both sides of the baby's head, but it does not cross suture lines and it has like clear edges. You also want to look for any caput-cecidinium, which is like a localized swelling on the head. It's caused by pressure against the cervix or like a vacuum extractor. And this will be soft and it will cross over suture lines and usually is resolved within 12 to 48 hours. And then you're going to want to assess the baby's clavicle and just note if they are intact, if they have any crepitus, or if there's any masses. You're going to assess the baby's abdomen. So you want to make sure that it's soft, rounded, and then listen to abdominal sounds, bowel sounds. And you want to make sure or note bowel sounds in all 4 quadrants. You're going to assess the umbilical cord and make sure that it is drying. You want to fold the diaper over to make sure that the umbilical cord stays out so it can dry. You want to look for signs of infection, like any pus. And you are going to turn the baby over. And this is where they could have their first tummy time. And you're going to assess their back, their vertebrae, all the way down to their sacrum and make sure that it is aligned, and look for the polondial dimple. You'll turn the baby back over, and you want to remove the diaper to assess the genitals. For a female, you want to make sure the labia majora and the minora are there. Swelling is normal. It's mostly due from the mother's hormones. And for male, you want to palpate the testes to make sure they are there. You also want to make sure that the urinary meatus is at the tip and that it is not above or below, or they would need to be seen by a urologist. You would let the family know that they would have to hold off on a circumcision in case any type of corrective surgeries would be needed. You're going to check the baby's reflexes. So for reflexes, you're going to do the palmar grasp, where you put your fingers in between the baby's hands and their palm, and they will grasp your finger. They also have the plantar grasp, where if you put your fingers at the base of their toes will curl around your fingers. The moral reflex is you will lift the baby up about 30 degrees and you will drop them. And the right response, or the appropriate response, would be for the baby's arms to extend, arms and legs, and then retract back in with flared fingers. The Babinski reflex is where you trace the outside of the baby's foot and then curl around to the inside of their toes, the top of their toes by their big toe. And you'll want their toes to flare. For rooting, you will touch the side of the baby's cheek and they should turn their head towards your finger. This is a necessary reflex for feeding because it helps them find the nipple. And then the stepping reflex is if a baby is held upright, they'll raise one foot and as if they're walking. I would also want to educate the parents on breastfeeding and letting them know that you would want 8 to 12 feedings in a 24-hour period. You're going to look for about 6 wet diapers and 4 bowel movements after 4 days. So once the baby's 4 days old, 6 wet diapers, 4 bowel movements. They are expected to lose some weight after birth. So within the first 3 days or 72 hours, they can lose up to 7% of their weight. But this will come back. They should reach back up to their birth weight, if not exceed it. Their first few stools, the first 24 hours, it's going to be mostly meconium. So that's going to be like a black-green color. And then on about the second or third day, once they're breastfeeding more often, their stool is going to change to more of a greeny yellow color. Once they go home, some signs for them to look out for if they need to call the doctor would be a temperature above 38 degrees Celsius, watery diarrhea, which would be difficult to differentiate between a normal stool, but there will be like a wet ring in the diaper where you could see water had soaked in. Vomiting would also be a reason to call the doctor. It can be difficult to differentiate between spit up and vomiting, but the volume with vomiting will be more like a full feeding, where spit up will just be a smaller amount. And also if they have any signs of respiratory distress, so any grunting, circumoral cyanosis with the blueness around the lips, or retractions. I would also teach them about safe sleep. So the baby should be alone in the crib on their back. So I would also tell them, if you're feeling sleepy, to just put the baby down in their crib and don't sleep with them on the couch. I would also show them what to do if your baby is choking. So you would want to support their head with your hand and have their body on your forearm. And you're going to use like this palm part of your hand and kind of tip the baby down a little bit. And you're going to essentially slap their back in an upward motion with the palm of your hand. If I were to finish my assessment and the mom wanted to do skin to skin, I would keep the baby unbundled and I would just put her or them on her chest, and then I would cover them up with a blanket on their back, or even like an opened up t-shirt, just to try to keep them warm. And at the end of my assessment, I would switch from having 2 blankets to just 1 to see if the baby could regulate their temperature and they could stay down to 1 blanket, and then maybe they could go home sooner. I would put the baby back in their crib, and that would be it.